CVS Health engages with millions of Americans every day in their communities, helping families struggling with an often confusing, disconnected system and the rising cost of health care. What's driving these costs is understood. Greater demand for care, growing medical provider costs, and persistently high prices for hospital care and prescription drugs. Every day we are addressing the fragmentation and the underlying cost of care. That starts by making care for Americans accessible and affordable, and most importantly, simplifying the patient experience at every point. Our 300,000 employees across the country work every day to meet this moment. I took this role 15 months ago because I wanted to help shape the future of healthcare in this country. I'm proud of the work we have done so far to simplify the healthcare experience and make healthcare more affordable and accessible for American families. I know there is much to do. It requires health plans, providers, and employers working together. That's why we support reforms that increase transparency, competition, and innovation, particularly among hospitals and in the pharmaceutical supply chain. We encourage policymakers to preserve flexibility for employers to offer benefits that meet their workforce needs and to avoid policies that reduce competition or add bureaucracy. We want to work together, first, to explore solutions that bring younger and healthier people into the risk pools. Secondly, expand the definition of preventative care to services that keep people healthy and out of the hospital, and allow people in high-deductible plans to access these services in their pre-deductible phase. Third, address the bad actors who are gaming the No Surprises Act, centralizing eligibility, automating processes, and increasing oversight can help address this abuse. Fourth, accelerate the interoperability of health records to reduce friction and help patients manage their health. And finally, pass the ECAPS legislation, allowing pharmacists to practice at the top of their license and receive Medicare reimbursement. This will benefit every pharmacy in this country while improving access for patients and reducing costs.
Mr. Joyner, you are the CEO of CVS Health, correct?
Correct.
And I actually don't know how many Americans know this, but CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health Medical Clinics, correct?
Yes, it does.
And in addition to that, they own, of course, CVS Pharmacies, and CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
And CVS Caremark processes nearly 30% of all prescriptions in a given year. And so, in other words, CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the US. In fact, I was following one of CVS's investor calls where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis. Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. I think The Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration is destroying people's ability to access care. I don't think we're seeing this across the board. And if they can self-deal, I saw something that was interesting from the opening statement of Mr. Hemsley from United Health talking about how much United spends, 85% on care, Mr. Hemsley?
Approaching 90%.
Approaching 90%, but the ACA forces you all to spend a decent amount of that on subsidies on care. But when you own the care, when the insurer owns the pharmacy, owns the PBM, owns the drug manufacturer, you also own the healthcare cost. You own a big chunk of the healthcare cost. And so, 100 years ago, we had this type of market concentration in our banks. And we did something about it when it crashed the economy. And we passed the Glass-Steagall Act. We should be considering that in our healthcare system. And if we believe in competition, I think we should put our votes and our legislation in alignment with that and consider breaking up this industry in order to allow the competition that prevents this kind of vertical integration and abuse of power. And with that, I yield back.
Most Americans have absolutely no idea what pharmacy benefit managers are, and AOC knows that. She also knows that that's exactly the way that health insurance companies want to keep it. It's not as if the health insurance industry or pharmaceutical companies robbing and ripping off the American public is anything new. We know that Americans are charged for pharmaceuticals at greater rates here in this country than they are in other countries because other countries' governments don't allow them to price gouge their citizens like we do here in America. Other countries don't have an open auction system like we do here in the United States. And we also know that pretty much everybody who has private health insurance, particularly if you have to pay for it out of pocket, if you're not getting it through work, your health insurance premiums could have tripled. A lot of them doubled. Mine personally doubled. I'm a contractor, so I pay out of pocket for my health insurance. Speaking of, I got to pay it now. You know what I mean? But, especially during Trump's reign, pharmaceutical companies and, agencies like United Healthcare are doing everything they can to price gouge people to get as much money as possible because they know that they're not going to be able to keep this up forever. They're going to, do what they can to see their record profits as they do every single year. And that's really the name of the game in my yellow sun hat, you know what I'm saying? But that's the name of the game. Keep corrupting the government, keep corrupting politicians so that they can make more profits at all costs, even if that means they have to lay off thousands of people. And this spreads across different industries. They'll lay off thousands of people so that they could take that labor money and buy their own stocks with it, or give the executives a bit more of a payday, golden parachutes. All these companies, again, that just profit at the expense of the public. And that's why AOC, we need her in the Senate.